Brine.
And let me add my congratulations to my good friend from Paul for securing the debate and kicking things off so clearly and setting out the challenge that we face here. I have to say, Mr Gray, that today's debate should be being responded to by Her Majesty's Treasury. That is no criticism of the excellent Hospitals Minister and Workforce Minister, who, until very recently, I was honoured to call a ministerial colleague in the department, and this is the first debate under the Health Department that I have spoken in since I left office. But seeing as we have a Health Minister here today, I thought I would make the focus of my remarks on patient care, which my honourable friend from Paul has set out. So when I first spoke to my local trust about this, the Chief Executive told me, and I quote, "The pension situation is having a significant impact on our people in Winchester and Basingstoke. The scheme is particularly affected by changes to the pension tax system relating to the annual allowance and the LTA, the lifetime allowance." As well as speaking to the leadership at my trust, I wanted to find out more from the horse's mouth. So members of the local clinical community, I asked them to come forward with some of their own stories, and I want to put a few of them on the record, if I may. So one consultant set the scene very clearly. He told me the issue here is the annual allowance pension tax taper, and I'll come back to that, and the inflexibility of the NHS pension, which is landing consultants with huge tax bills for doing extra work on top of their contracted hours. He was clear, Mr Gray, not least as a former health minister myself, I agree, this extra work keeps the NHS running in the face of this ever-increasing demand. Now, I was told that in certain circumstances, the marginal tax rate on earnings for this extra work is greater than 100%, which means that senior doctors working in my hospital are effectively having to pay to do extra work. Now, I know that they are some of the most committed individuals in public service in our country, and I have had the privilege to work close up with many of them, but that really is taking it a bit too far. This is clearly not a sustainable situation, and now that these huge tax bills are landing on doorsteps, it's causing a huge change in behaviour of consultants at all levels. Some facts back at trust level, if I may. Hampshire Hospitals, which recently ran a survey on the pension issue and received a healthy 2,500 responses. 42% of all respondents have reduced their work commitment, 20% have avoided promotion, and critically, when asked who might change working practice in the future, it goes up to 80%, including 33% considering early retirement and just over a quarter considering leaving the NHS altogether. Now, Mr Gray, I have no doubt that the changes were introduced in good faith. They're aimed at the top-rate earners, which the gentleman from Paul said. But this has, in practice, had a damaging effect on our key people in the NHS. And if it's not sorted quickly, we will see this escalate further, and it will be harder and harder to retrieve the position. So suggestions put to me for fixing this include removing the annual allowance tapering. When I spoke in the urgent question earlier this month, a number of consultants from across my trust and Paul and Southampton contacted me, and they're pleased that the consultation, which I'm sure the Minister will speak a bit more about, that is imminent. But what they fear from that is the 50-50 fudge will just not work. We need wholesale reform, and the taper really does need to be scrapped. In addition, Mr Gray, I would ask the Minister whether it's worth considering whether the annual allowance taper should be removed for public sector workers. Now, of course, that's not a decision for him. That is a decision for the Treasury and for whoever inhabits number 10 in a few weeks' time. I may be well placed to influence that. I may be not at all placed. But the point is this. If we want to make the NHS a great place to work, then why not provide a tax benefit to working for the public sector, one of the biggest employers in the world? It is food for thought. Let me finish, as I've tried to make my contribution this morning, with some real-life examples from Hampshire Hospitals of what we're seeing at trust level. So in Winchester, like everywhere else, as I've set out, the Royal Hampshire County Hospital is one of the 3 hospitals in that trust, relies on many doctors and senior staff doing additional sessions over and above the timetable work in order to fill the gaps in medical workforce. Now locally, I'll finish with this example, we have seen this especially in radiology, where the additional sessions are used for radiologists to review scans and write the reports about what they see. The reporting of scans is clearly required so that patients can be told what that shows, and so clinical staff can work with patients on the most appropriate treatment. Now, my good friend from the SNP, who is here, and we'll hear from shortly, and I have spent many hours in this chamber when I was the cancer minister, and I was extremely proud to get the 75% stage 1 and 2 diagnosis ambition into the long-term plan as announced by the Prime Minister. This is critical. Early diagnosis is cancer's magic key, as has been said by me and others many times in this chamber. If we are to get anywhere near that ambition, we have to have functioning, improved and expanded radiology service. Any reduction in radiology and that diagnosis stage will adversely impact and make that ambition unattainable, in my opinion. I am reliably told by my trust that they have seen the backlog of scans waiting to be reported growing each week over the last few months. That concerns me greatly, Mr. Gray. It's just one department, of course. It's an area that I know a little bit about, but I think it's a sober example and one that we simply cannot ignore. So I will finish by saying this. Unless we act, and I have so much respect for the Minister in his place, we need the Treasury to take this seriously, and we need the next Prime Minister to act. If we don't, this will only get worse. We need to grip this, and we need to grip this fast. Thank you.